It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives.
Right indeed, Candace. This is the place to come to find the right doctor, because these are the doctors that are helping change people's lives, as Candace said, like our first doctor, orthopedic spine surgeon, Dr. Robert Miles.
Growing up, horses were a big part of my life. I rode every day, several horses a day, and competed through high school. The main problem I was having in my low back was that the discs were degenerating, and I was told it was common in 60-year-olds, not in 30-year-olds. I had some tears that were leaking fluid and was having pain and discomfort down my legs that was keeping it where I couldn't sleep and was just in chronic pain. Did therapy for my back but still had issues. Slowly things started to go, like riding the bicycles or certain chores around the house.
I generally tell people that surgery is the last thing that we want to do. If the pain is so severe that it starts to interfere with your life, your hobby, your friends, your work, then it might be something that you should consider. If you're in that situation where you have to come home and spend your life dealing with the pain, then surgery is probably something that's a consideration if you failed all the other conservative treatments.
Being that I live in Kansas City, I was from the Dallas-Fort Worth area. I had seen a few doctors in Kansas City and not really gotten any definitive way to get relief. After seeing the Best Docs episodes and watching Dr. Miles, I decided that he would be a good person to contact, and he was willing to look at my information and tell me if he saw anything. And he did see several things that my doctor in Kansas City did not see.
Generally with the surgery process, our goal is to decrease your pain, and our main goal is to get rid of your pain. So that's what we're trying to do when we offer you the surgery, is to get you back to living your life the way you were beforehand with pain freedom.
When I heard other patients talk about achieving pain freedom and that was Dr. Miles' goal, it sounded like a nice idea, but I didn't really think it was possible for me. It's been 3 months since the procedure, and I feel better than I can remember feeling. I thought I would be able to return to riding in January, but now he has told me I can move that up to next month. I'm very excited what he's been able to give me, and really have given me what he promised, which was pain freedom.
I was experiencing chronic migraines 24/7, so 24 hours, 7 days a week. The only relief I was getting was sleep. So I would be willing to try anything. I would go to a neurologist. He tried every medicine in the book. Couldn't figure it out. He says, I met a doctor with the new procedure for stimulation for chronic migraines. Okay, let's go, let's see what happens.
The specific treatment we do here is an implanted neurostimulator for severe headaches. It's a unit that goes completely under the skin. It's somewhat akin to a pacemaker for the heart. There's a very small battery that's implanted under the skin, and from the battery, typically 4 very thin little plastic covered wires are passed up under the skin, 2 in the back of the head, and 2 of them end up right above the eyebrows. It's all under the skin. In fact, you can't see any scars or lumps. But once it's in, when it's turned on, they'll feel just a very mild tingling sensation in the front of the head and the back of the head. And by certain mechanisms, when they feel that, it very commonly either stops or dramatically improves their headaches.
After the stimulator was put in, I could see a dramatic change. I didn't have to take any medication, except for a cold front coming in. I would just take a daily Advil Sinus or a Tylenol Sinus just to kickstart it. And then once I get my headache under control, the stimulator could take over. That's when I knew this was going to work.
Michael had these severe, basically daily, devastating headaches. Michael Parker kept on with life. He refereed the sporting events around here with the kids. So he was fighting through it, but it was still greatly limiting him. So it's been a couple of 3 years now to put it in. Michael has done great.
Whoever has migraines out there, take a look into this, because this can change your life as it has changed mine. I would drop dead to save that man because he saved my life.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. And now let's meet our next doctor who's changing people's lives. It's General Surgeon Dr. Philip Swanson.
Before I went to see Dr. Swanson, I was 200 and something pounds. I had a 2-year-old little girl. I was on the sidelines a lot. You know, I was that big parent, not very healthy, not very active, and I wanted to participate more with her in her life and the things that were going on with her. She was 2, she was walking, running, and very active. So that's what drove me to go see Dr. Swanson.
The advantage of the sleeve is that when you remove that part of the stomach, you change the communication of your insides. People think of the stomach as just a bag to hold some food, and it makes some acid, and yeah, there it is. No, the stomach is an amazing organ. It manufactures several hundred chemicals that communicate to the pancreas and the liver and the brain and the fatty tissues. And all that communication goes on all the time. So when you remove part of the stomach, you change that communication, and that's when amazing things happen.
Within 2 weeks, 3 weeks of the surgery, I'd already had dramatic weight loss. To date, it's been a year from my surgery and I've lost 120 pounds. Life has changed dramatically. When I go to the doctor, my doctor is just floored at the progress that I've made.
People seem to have a place where they live as far as their weight. They've been 300 pounds for the past 10 years. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 160. When your brain thinks you should be 160, and it's getting the signals from the fatty tissue saying, oh, we got all this extra reserve out here, the brain says, we got plenty of energy. We don't need to eat. And these people are not hungry. It's amazing.
If I hadn't had the surgery, I don't know what it would be like, to be honest. I mean, I wasn't there. I work out 3-4 times a week and it's not hard and it's easy now. And before it was just so hard, it hurt my knees, it just wasn't fun. And now I can go to the gym and I don't mind wearing the gym clothes and it's great. It's fantastic.
Let's talk about your bones. Bone health is very important, especially in women. You can get osteoporosis, that's very thin bones. And also there's mildly thin bones, which we call osteopenia. Now, what causes this, or who's at risk for bone thinning? Well, generally it's females. We often see it in Asian people, as well as people with very thin bones and low weight, under 126 pounds. People with red hair, blue eyes, freckles, and fair skin, they tend to get a lot of osteoporosis and a lot of osteopenia. The way you diagnose this is through a bone density scan. That should be done at your doctor's office. Now, if you do have osteopenia or osteoporosis, you need to be on calcium and vitamin D. Generally 600 milligrams of calcium twice a day and 400 international units of vitamin D twice a day. If you take it all at once, that's not going to do the trick. Half of it will go out in your urine. You must take the daily dose and split it in half Take half in the morning and half in the evening. That way it'll get into your bones very well.
We are excited to welcome to the Best Docs program prosthodontist, that is Dr. Dave McFadden. He is the architect behind the world's greatest smiles, also known as the go-to dentist in Dallas. Go-to dentist, how did you get that name? Is it because of the practice, the outstanding procedures you do, the techniques? What is it, Dr. McFadden?
Well, it's a little bit of all of those things, but I think mainly it's the credentials. I've taken the time and the energy to do all the things that are possible in my specialty and become board certified in a couple different things. So I think it's the credentials more than anything.
You know, something I thought that was interesting when I was reading up on this is a lot of people think, hey, if I'm going to get a new smile, what I'm going to see is a cosmetic dentist. Not so.
A lot of people make that mistake because they've been misinformed. Cosmetic dentistry is not a specialty, it's just a word. General dentists use the word cosmetic dentistry to try to attract patients that should end up in a prosthodontist office.
Now, dentist dignity. When you hear that, what comes to your mind?
Well, we've adopted that phrase in our practice, trying to treat people with dignity. A lot of the other practices in town are high volume practices where they're trying to get the most people in the door that they can. And many times those patients don't even get to see the doctor before their treatment. So our approach is completely opposite of that. We bring our patients in, we educate them, they meet with a doctor from the very beginning, all the way through the consultation. It's in a private consultation room with the doctor, and we're answering questions as we go through the treatment planning process. So we consider that a dignified approach to dental treatment.
If I'm out there and I'm looking for a new smile and I want to, have a nice gleaming white smile, and I'd say, okay, I'm going to go see the best, and the best is Dr. Dave McFadden. Will I be out a fortune?
Prices for dental treatment are expensive. No matter where you are in the country, they're expensive. But competition keeps everybody's fees pretty well in line. There's so many people trying to provide the same services that we all have to be about in the same range of treatment. And so no one should exclude themselves from one practice or another because of cost, but it is expensive treatment.
All right, I tell you what, this is the guy to go see, America's dentist, Dr. David McFadden. Appreciate it. Good to have you part of the Best Docs Network. Mike, a loving father of two, was in severe back pain until he met family physician Dr. A.L. Shaw. To find out more about Mike's story and other life-changing stories, log on to bestdocsnetwork.com.
The way I met Dr. James, he's actually coaches my daughter's soccer team. He had overheard a conversation I was having with another mother saying that one of my MRIs had come back and that my thyroid didn't look quite right, but I really wasn't putting a whole lot into it because I didn't really have any of the symptoms.
Patients with thyroid problems can range in two different areas. One is if they have hyper or hypothyroidism and they feel tired, run down. They'll have a change in appetite, sometimes hair loss, and in some cases patients will have a thyroid nodule, an enlarged thyroid, and that's typically when they get sent to myself or an ear, nose, and throat surgeon to evaluate.
After I had all of the tests done, my husband and myself went into his office and met with Dr. James to discuss how we were going to move forward after they had found some atypical cells in my thyroid.
In the case of Ruth, she presented from her primary care as a referral for an evaluation of a thyroid nodule. She underwent a needle biopsy of the thyroid nodule, which showed evidence of possible cancerous cells. We took her to the operating room and performed a biopsy of that portion of her thyroid gland, and during surgery, pathologist reported that in fact it was a thyroid cancer. We took the rest of her thyroid out in that same setting and removed all thyroid tissue completely.
I really expected to be in more pain. The first 2 days were pretty rough, but after that, it wasn't nearly as bad as what I thought it was going to be.
She then stayed in the hospital for one night and went home the following day, and after approximately a week was back to a normal activity and doing well.
If it wasn't for Dr. James, I think I would have blown it off if he would not have said, hey, this is kind of serious and it's more important than, fixing your neck, and you need to, you really need to put more attention towards this. It's so important, to go and have those tests done, to take that extra step, make the time. With 4 kids, I have an extremely busy schedule, and, I just had to put everything aside and say, okay, right now, I'm more important.
Of course, don't forget, for more information on any of the great doctors you see on today's program, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. And Candace, let's head up to our next best doctor.
That's right. Next, we're going to meet Dr. Cesar Duclair, who's a pain management specialist.
When patients come in to see me to talk about pain management, one of the first things we're going to talk about is how are they managing their pain. If they're in pain, then they're not going to have a good quality of life. That's why I became a pain management physician, return patients to a better quality of life and give them pain freedom. The first treatment process, it really is just listening and then educating, and then physical exam. Oftentimes we're taking some x-rays to make sure how much arthritis a patient may have, if they had any previous fractures. And sometimes, especially with the back or the neck, they may have had a fracture and we're never told. Then we'll talk about if we need to do any more further imaging, some more complex imaging, or if we have to do any electrical studies to find out if they have any nerve damage. We'll talk about if they have any instability, and then we'll talk about how we correct and treat that. There's so many medications, it just runs the gamut. There are over-the-counter anti-inflammatories, which are fine. There are prescribed anti-inflammatories, mild narcotics, heavier narcotics, neuromodulating medications or medications that decrease the irritability of nerves, different medications that are transdermal, they go through the skin, that can help out with some of their pain as well. So it's sort of a rainbow of different medications that we can give. Oftentimes, patients will be taking medications and they can become frustrated with that, and they're looking for something that lasts longer, and that's when we start talking about doing injections for them, epidural injections, nerve blocks, facet injections, and that can help out with decreasing their pain for a longer period of time. While somewhat more invasive, it's still very, very safe, very fast to do, and can give up to weeks to months of relief. Our ultimate goal is to give people pain freedom to go out about and do their normal activities and really enjoy life again.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, Pam is here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
My cycles used to last, maybe 3 or 4 days, and they started lasting longer, sometimes a week and a half. And it was physically draining, and mentally I would just be in another world.
There are 2 minimally invasive procedures that we offer in the office setting. One is endometrial ablation. So this is a treatment procedure for heavy, painful periods. It is designed for those women who are done with childbearing and don't want to continue to be on medication to control menstrual cycles, don't want to have aggressive surgery like a hysterectomy for their menstrual cycles, but yet are having problems every month with their cycles.
We discussed different options, and she told me about ablation and exactly what the procedure was and what the outcome could be. And then I went home and did some research on the net, and then I finally had enough, and I called her up and told her, what, I'm going to go ahead and try it and just see what happens.
I basically counsel patients that if they have ever had to change their plans because of their menstrual cycle, they ought to consider a treatment of some sort, and this is a very, very good one for those patients who just want a one-shot deal and they're done.
The procedure was quick. I was in and out, went home, laid down, and the next day I was fine. I got up and was able to do my usual stuff around the house.
So they come in, the procedure takes pretty much an hour door to door. We do an IV sedation. They go home, and by the next day they're usually completely over the effects of the surgery and anesthesia.
There was no cramping of any kind, just slight bleeding, and that was it. I didn't have the terrible headaches that I had prior and during, and my second cycle I had no symptoms at all. No bleeding, nothing. In my opinion, the best thing I ever did.
The Best Docs Network is all about doctors helping change people's lives, like our next doctor, Mohs surgeon, Dr. Patrick Walsh.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that were removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says they might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Wattier presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
So you had to do a little patch in there. See, the ears aren't the same. So I lost part of my ear here. It's healing up a lot better than I thought.
So he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I was having a lot of decongestion, sneezing, nosebleeds, and severe headaches. And we found out that Dr. Worrell now has the allergist in his office, so when I spoke with him, he gave me time to go down and talk with the allergist, and then I started talking to him about my symptoms.
Typically, people will have allergies that show themselves in a similar pattern at the same time each year if they're seasonally related. Sometimes environmental allergens will show themselves as part of their history in terms of if they're allergic to dust or if they're around dogs or cats. And so after we question the patient appropriately and do the appropriate exam, then we go ahead and if the patient is inclined to do so, send them down to our allergy lab here in the office.
I was given the allergy test, so I got about 50 needles in both arms and realized I'm really allergic to pollen and mold and ragweed, and that's why I was coming to Dr. World so consistently, and why I was not able to breathe and had these bad nosebleeds.
Questions are given to determine that they are good candidates for testing and desensitization, and then they proceed with a procedure that takes about 30 minutes. And during that time, the 48 top allergens in the area are tested on skin testing. The results are measured out, and the determination is made whether they're a good candidate.
The first steps that we have to go through, I got to come in the first week and I have to get my first round of shots. And so I get a shot in my left and my right arm. So my first visit, the allergist gives me the shot. And then the second visit, I give myself the shot. Eventually, I'm just going to have to come into the doctor's office just to get my meds and then take them home and give myself my shots. And so I'm going to probably take these shots for about a year.
Usually within a few months, they'll be having significant relief of their allergies. And then we continue that on for as long as 2, maybe even 3 years.
My relationship with Dr. World, first of all, I love him. He's definitely one that explains everything to you. He's really friendly, his staff is friendly. I really trust him when he tells me anything that's going on with me. I just can't see myself going anywhere else. I really enjoy coming to him.
Plantar fasciitis is actually just inflammation of the plantar fascia, which is the large ligament on the bottom of your foot that goes from the base of your heel to your toes.
I was doing fine until I kind of changed my routine, started running again. For the longest time, didn't really feel any heel pain, and then all of a sudden, just really sharp pains, after I'd be done.
The more common signs or symptoms are pain with first step in the morning, pain after being on your feet for extended periods of time, or even later in the day, pain after taking short rests and getting back on your feet.
Started with some treatments, started with, just doing cortisone shots, did a series of those, as many as you can, which is about 3 shots. That didn't work. Then I said, okay, well, let's just try, physical therapy. Did physical therapy for several weeks. That didn't really work, and so we came to doing this treatment.
EPAT is, it stands for Extracorporeal Pulse Activation Treatment. It is a highly effective, non-invasive treatment performed for plantar fasciitis. It works basically by a set of unique pressure waves, and what it's doing is increasing and enhancing circulation to the area and promotes the healing and speeds up the healing process. It's performed in the office. It generally takes 3 treatments, which we do 1 treatment per week for 3 weeks. Has a success rate of over 80%, and there is really no downtime or risk with the treatment at all.
When you come in, you're here maybe half an hour, and the treatment probably takes 10 minutes at the most. But by the time they set everything up, you get in and out, you're in and out in about half an hour. So, as you're coming through, you do 3 or 4 treatments, and then you're typically done. So I've had 3, and I'm on my last 1 round.
She's done very well. In fact, I think she's back to most of her activities and really is pretty much pain-free.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that, of course, are changing people's lives.
Yes, and if you want more information on any of these great doctors, Candace, where do the people find them?
To our website, bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. It's info@bestdocsnetwork.com. Coming up next, don't miss it. It's Best Docs Network featuring Forest Park Medical Center, one of the top medical centers in the entire Dallas-Fort Worth area.
And that'll do it. That wraps up another edition of the Best Docs Network. Have a great day.